Hello friends, I'm Dr. Shumayu Datta. I'm a consultant spine surgeon from Calcutta. I've been practicing here for 10 years now. So in spine surgery, we often deal with complex spine pathologies. And in such cases, millimeter precision becomes very important. An O-arm is a navigation tool that allows us to work with sub-millimeter precision in and around the structures of the spine. So when I say navigate around the structures of the spine, you may feel that, yeah, but when you're doing a surgery, you're looking into the structures, you can see what's in front of you. Why do you need to be navigated around that if you can see what's in front of you? But that's not entirely true. In spine surgery, we are often working through very small corridors. We look at the anatomy at the back, the parts that we've exposed, and we have to make assumptions on what's in the front and how that anatomy is going to be in the front, and then work our instruments through that. The O-arm allows us to put in high precision instruments and implants into the spine without really even making a large cut in the skin. So you don't have to look into the spine, but you can see everything in 3 dimensions on a screen. So in this case, you see me operating on a lady who has been suffering from ankylosing spondylitis. She fell and she had a fracture in her spine, and she developed severe pain subsequently. So I had scheduled her in for a surgery, and because it was going to be a very long surgery if we had to open it, we planned to do this using the navigated machine. Now a little bit on the navigation. I'll tell you how the navigation works. Similar to how you open Google Maps and you put in a location you want to go to, you're seeing the street in front of you, but it gives you a pathway which is the most optimal pathway to work with, and then it's up to you whether you want to use the pathway or not. The O-arm is brought in, it completely encircles the patient, and it takes 360-degree x-rays like a CT scan in the operation theatre, and it runs up and down the patient. Thereafter, I can use my normal instruments and I can look at a screen and I can see a 360-degree representation of the spine in 3 dimensions. And all of this helps us put in the screws with high degree of accuracy. In fact, in her case, I didn't even have to open the spine. I was able to perform the entire surgery through small stabs on the skin, because once you know what's in front of you, you don't really need to open it and take a look inside. And this has several advantages. There's smaller wound, lesser blood loss, earlier recovery. They come out of surgery feeling much more energetic, they recover, they rehabilitate faster, and it's a big advantage overall. This has been a game changer in all these complex spine cases, deformities, revisions. Patients often come to me in severe distress, in pain, with their activities of daily living being severely affected. They hope and expect that we use the most advanced precision tools available to help them recover from their ailment. And the O-arm navigation has been a game changer in that, allowing us to predictably give very good outcomes to our patients. This lady who I operated on was smiling ear to ear the next day. She was walking, she walked the ward, she went home after 2 days after such a major surgery, and it's been a few months now. We're in touch and she's very happy with the outcome. I hope to see you at the next video. Stay fit, stay active.